Today we'll be speaking with the Minister of Health, Dr. Frank Anthony, on the vaccination number in Region 10 and also on the low testing rate in the region. Let's meet the Minister. Hi, good day, Minister, and thank you for having me here. Let's begin today's update with the vaccination of health workers in Linden, at the Linden Hospital. What is the current status of vaccination there?
Well, I don't have specific numbers for healthcare workers at the hospital, but what I do have is vaccination numbers generally for Region 10. And what I can say to you is that Region 10 has the lowest numbers. For first dose vaccines, people in Region 10, we've just completed about 5,693 vaccines first dose, which approximates to about 20.7% of the adult population of Region 10. And for second dose, it's much lower. We just have about 2,588 persons who would have been fully vaccinated in Linden. This is just about 9.4%. So of those who were vaccinated, got their first dose, just about 9.4% came back and got their second dose. So as you can see, this is really low. The national average for first dose vaccines is 58.1%. That's where we are today, 58.1%. While for Linden, that's just 20.7%. So there's a big difference between what the national average is and what is happening in Linden. And again, for second dose vaccines, the national average is 29.8%, and in Region 10 it's 9.4%. So there's a big gap here.
Art Minister, what does this mean for testing? I know that there's low vaccination numbers in Region 10. What does it mean about testing? Are we testing as much persons there?
Well, again, there's another anomaly in Region 10, and that is perhaps there are lots of people there who might have signs and symptoms of COVID. These are flu-like symptoms, but they don't come for a test. We know with COVID there might be people who are asymptomatic. So if you don't do a test, you would know whether you're positive or not. Again, the testing numbers in Region 10 has been relatively low. Since we started testing, and that is from March 2020 to present, we have only done 8,265 tests in Region 10. And that is really low. And when we did those tests, and just to give you a comparison, for the rest of the country overall, nationally, from the same period, we would have completed 251,230 tests across this country, but in Region 10, we were only able to do 8,265. So it's relatively low in Region 10, the testing, and because many people are not coming forward to get tested, it means that our rate of detection persons with COVID in Region 10 has been much lower. So it's not that the disease is not there, it's just that people don't want to be tested. And if you're not tested, then we can't for sure say that you have COVID or not. So I think people are staying away from the testing sites because we have quite a number of testing sites in Region 10. If you stay away from the testing site, you refuse to go get tested, then we would have these low numbers, as is seen by what we have looked at so far.
Minister, is that in some way cheating the system in allowing the country to know its actual status in terms of vaccination and testing, and persons positive with the virus?
Well, for some people, if they don't want to know, they don't want to get tested, I think that's a foolish approach. But what we should ideally have is people coming forward, they get tested. If they're positive, we can take certain actions. If they're negative, that's fine. But people ought to know what is the status with COVID, especially if you've been exposed to someone who, who's carrying COVID. So even with the low testing rates that we have in Region 10, so far we have been able to detect 1,585 persons who've tested positive in the region. I'm sure this is an underestimate based on the low testing rate. And of these persons who have tested positive, about 13% or so would have been hospitalized, meaning that we had 208 persons who were in hospitals in Region 10. And some of them were so critical that we had to bring them down to the Ocean View facility. And of those who were severely infected, we've had 47 deaths in Region 10. Because there's another fallacy that is going around that people in Region 10 are not dying from COVID, and hence you don't need to get vaccinated. That's totally untrue, because we've had 47 deaths in the region so far, and therefore, if people want to protect themselves, like everywhere else in the country, then they ought to go and get vaccinated. We have a number of vaccination sites in Region 10, but for most of the time, they're vacant or they're empty because people are not coming forward to be tested, to be vaccinated. So that remains a challenge, and I do hope that the leaders in Region 10 would really step up, and instead of advocating against vaccines, should actually help to protect the lives of people of Region 10, the people who they represent in Region 10, and get them to get vaccinated. We know that with current strains or variants such as Delta, that the virus is more aggressive, it's more infectious, so people who are unvaccinated are going to end up in the hospital, and some of them unfortunately are going to die. Now, we have an opportunity to prevent that from happening if we encourage people to be vaccinated. Outside of Region 10, Region 8 is also lagging behind. We're at 38% of persons in Region 8 receiving the first dose, and 23% of them would have gotten their second dose. But they're still lagging behind. And, as I said before, the national average for first dose is at 58.1%. And most of the regions are around that vicinity. Some of them are above that, but these two regions are certainly lagging behind. And we really need the leaders in the community, whether it's political leaders, whether it's faith-based leaders, people with influence in the community, should really step up and talk to the people about getting vaccinated. This is not something for us to play around with, because if people are hesitant and they don't get the vaccine, then it can really cost them their life, literally. So as of yesterday, we are now at 298,248 persons who would have received their first dose vaccine, which I have said now approximate to 58.1% of our population. And for second dose, we are at 152,997 persons who would have received their second dose of the vaccine. That's now at 29.8% of our adult population. Again, we have a number of first dose vaccines available to people. So we have AstraZeneca, we have Sinopharm, we have Sputnik V, and similarly for second dose we have AstraZeneca, Sinopharm, and Sputnik V. So persons who want to get those vaccines, they are available. Sputnik V second dose, we have been having some challenges in getting enough second dose, but we are getting supplies on a weekly basis, and as soon as we get it, we get people to, we announce it so that people can come forward and get their second dose vaccine. Well, I don't think it would prevent anything. Again, let's think about how COVID-19 is transmitted. COVID-19 is transmitted if you inhale the virus. It can be either through droplets, so somebody in the room might sneeze, it contains viral particles, so you inhale that. Or you inhale the normal room air, but in that room air, there's also aerosols with viral particles. So if you inhale that, it's going to get into your nose. It can start by infecting the cells in the mucous membrane of the nose and then goes down to the lungs. So steaming really doesn't help, because once the viral particle gets into your nose, it attaches to the cell, it then would get into the cell and start the replication of the virus within those cells. The cells, they have special receptors that these viruses would attach to. Steaming obviously would not help to prevent that from happening. What is more effective is if you have a physical barrier, such as using a mask, and we know there are about 3 main types of masks that people normally would use. You have the cloth mask, which is not as effective, but it still helps. You have procedural or surgical types of mask, which they're generally 3-ply, meaning that it has 3 layers, so it would be able to filter out some of the particles. But the best one would be the N95 mask. And those really, they have 5 layers, and they prevent viral particles from getting into your nose or into your mouth.
This has been the COVID-19 update with Dr. Frank Anthony. For more information, you can visit the ministry's website at health.gov.gy, our website at dpi.gov.gy, and our social media platforms. Join me and take your vaccine in the fight against the COVID-19 pandemic. Godfrey Brooms saying goodbye for now.